First, let's describe how control of livestock diseases works as practiced in Japan. Japan protects livestock from infectious disease epidemics at 3 levels. First is the farmer's level. Appropriate hygiene management and early reporting are obligations for livestock farmers. Next is the region level. Livestock hygiene service centers are located in 168 places in 47 prefectures to provide services such as infectious disease diagnosis and hygiene guidance. The national government provides legal arrangements in order to prevent invasion by livestock infectious diseases from overseas. Animal Quarantine Services of Ministry of Agriculture, Forestry, and Fisheries conducts import and export quarantine of animals, restricts the entry of livestock products and processed livestock products, and disinfects shoe soles using disinfection mats at airports. The National Institute for Animal Health of the National Agriculture and Food Research Organization conducts research on prevention, diagnosis, and treatment of livestock infectious diseases and makes definitive diagnoses of samples sent from livestock hygiene service centers. Farmers are the first to deal with any abnormalities found in livestock. All the farmers contract with their own veterinarians. We spoke with one of those veterinarians.
普段、農家さんはご自身たちで病気の治療をされることも多いんですけれども、それでも手に負えない、もしくはこれはちょっと自分たちじゃ難しいなと思う症例に関してはもう発生したらすぐ獣医師に診療の依頼の連絡が来ます。でそれは地元の開業している先生であるとか、あとは家畜共済組合という、保険に入っている農家さんであればその共済組合の先生が診療に来てくださいます。
A primary veterinarian will visit a farm immediately upon request from a farmer to examine and treat animals and provide advice on preventive measures. The farmer must report quickly and accurately when an infectious disease is suspected.
重要な疾病に関しては、まずその家畜保健所に届け出の義務がありまして、で家畜保健所からさらに都道府県、さらに国の方に報告が入ります。でそれは一つの法律の中に、2種類の大きな病気の、カテゴリーが分けられています。で届け出伝染病というものと家畜伝染病という2つ合わせて監視伝染病というふうに呼ばれるんですけども。
A primary veterinarian is contacted when a livestock farmer detects an abnormality. If they suspect a monitored infectious disease is suspected, the veterinarian contacts the Livestock Hygiene Service Center. Veterinarians from the Livestock Hygiene Service Center will rush to the scene to investigate the outbreak and collect samples, examine, and diagnose. Monitored infectious diseases are reported to the national government by the prefecture. Domestic animal infectious diseases, such as foot and mouth disease, and highly pathogenic avian influenza in particular, are reported promptly to the national government by the level at which they are suspected, and definitive diagnosis and preparations for culling proceed simultaneously in parallel. Measures to prevent invasions of malignant infectious disease are taken quickly and accurately with the 3-level system, consisting of livestock farmers, prefectures, and the national government. This livestock diseases control system is supported by law with the Act on Domestic Animal Infectious Diseases Control, which is intended to promote the livestock industry by preventing outbreaks and stopping the spread of infectious diseases. Now let's look at the history of development of the livestock diseases control system. The impetus for Japan's livestock diseases control system was rinderpest, which was epidemic in the regions of Manchuria and Siberia. As damage spread with the invasion of rinderpest into Japan, regulations were issued at the regional level and laws were enacted. Since then, it has been possible to deal flexibly with many diseases based on the Act. The current Act on Domestic Animal Infectious Diseases Control has been amended many times for various infectious diseases that have hit Japan since 1951. We have a strong cooperation and legal arrangements between sites and governments. Nevertheless, infectious diseases continue to occur. Various types of domestic animal infectious diseases have occurred in Japan in recent years. Highly pathogenic avian influenza, for example. In 2004, outbreaks were confirmed in Japan for the first time in 79 years. While roughly 300,000 birds were slaughtered nationwide that year, and things settled down, it has occurred sporadically since then. When highly pathogenic avian influenza occurs, there is not only direct damage, but also impacts such as a drop in demand for chicken meat. The total damage has been calculated at more than 13.8 billion yen just from January through April 2004. Foot and mouth disease for another typical example. Japan is free from foot and mouth disease, but this virus jumped the barrier of international border quarantine to enter Japan in 2010 and caused the outbreaks for the first time in 10 years. Roughly 300,000 cows and pigs were culled to prevent the spread of infection and restore Japan as a disease-free country. It has been reported that recovery took 3 years, and the total damage amounted to 235 billion yen in Miyazaki Prefecture alone. We spoke with Dr. Ikeda, who worked in a neighboring prefecture during the outbreak.
当時鹿児島県で勤務してたんですけども、鹿児島県でもその口腔内口からよだれを出しているかとか口蹄疫を疑う症状があった場合は、速やかにやはり家畜保健所の方に届け出を何回かしました。でその場合はやはりもうその発見したらですね、その場でもう農家さんも獣医師も実際に家畜保健所の先生が来て診断が出るまで動けないんですね。他の農家さんに行ってはいけませんというのがありました。
When a major domestic animal infectious disease occurs, national and prefectural governments, as well as relevant regional bodies, collaborate on things such as prohibiting movement of livestock, mobilizing workers from other prefectures, and the self-defense forces for culling and burial work, restricting traffic, and disinfecting ordinary vehicles. What changes to the infection prevention system on farms were spurred by the foot and mouth disease outbreak?
で家畜保健所としても、指導したのはですね、まずは牛舎の消毒なんですね。で無駄な人の立ち入りの禁止、この2つを農家さんたちは徹底されました。そうするとやっぱり不思議なことに感染症病気って出なくなるんですね。なので病気の予防というと、ワクチンであるとかいろんな抗生物質を餌に混ぜるとか言われがちなんですけれども、基本的にはやはりもうベースは不必要な人の立ち入りを制限する、なおかつ牛舎の中を常に清潔に保って消毒などを併用するということがもう一番の伝染病の予防効果があるのだなというふうにすごく感じました。
必要と消毒はもうやっていただかなければ。
Currently, it is mandatory to keep a record of names, date, and time when entering farms for epidemiological investigation in case of disease outbreak, and to change and disinfect boots when entering barns. This is how invasions of livestock infectious diseases are prevented at the farm level. Japan's livestock diseases control system is expanding overseas. Since 2008, there has been a lot of livestock movement across borders, and assistance has been provided with focus on the site level in Cambodia, Laos, Malaysia, Myanmar, Thailand, and Vietnam, including the establishment of technology for livestock disease diagnosis, reinforcement of livestock hygiene guidance to farmers, and establishing systems for rapid communication and reporting of livestock diseases. Protecting livestock from infectious diseases in livestock spreading across borders is impossible with border infection prevention by a single country. Therefore, JICA has been supporting technical cooperation in projects in various countries to control and respond to livestock diseases, with the world unifying and many countries cooperating to share information going forward.
Okay, thank you for watching. And oh, can you hear me now? Oh, is my microphone working? Oh yeah, all right. Okay.
Yes.
So, oh
Yes.
yeah, thank you so much. So we still have time. So let me emphasize some points which is important in terms of the understanding of animal health services in Japan. All right. So this diagram is quite important. So I hope you completely understand this diagram before starting the other sessions. Okay. So there are three layers, and the first layer consists of farmer and veterinarians. And in the video, as you watched, there are two types of private veterinarians in Japan. So one is individual private veterinarian, which has their own clinic in. And another type of veterinarians is that those veterinarians belong to Japan Agriculture Mutual Aid, and that system is a kind of insurance company, and supporting farmers. Then big number of livestock veterinarians belong to that association. And the farmers who have insurance can call the veterinarian who belong to that association, and the veterinarian can visit the farm immediately to give instruction or medication, or sometimes operation on site, without and the farmers don't need to pay to the veterinarian because they have insurance. So the insurance covers not only the insurance for dead animal, but also the veterinary services, which is offered almost freely. And when the farmers buy the insurance, the half of the insurance is paid by the farmer by themselves, and another half is paid by the government. So they need to pay 50% of the insurance. Then once they pay annually, they don't need to pay for the veterinary service. So and this is kind of unique system in Japan. So there is private veterinarians who belong to that insurance association, and there are also other private veterinarians who have their own clinics. But anyway, for farmers, important thing is that when they call the veterinarians can immediately visit the farm with a mobile clinic, which has drugs or operation equipment or ultrasound diagnostic device or something like that. And you will visit one of the veterinary clinic which belong to the animal health insurance association in Obihiro when you visit there. So you will visit one of that clinic, so you can fully understand the system of the insurance and also how the farmers can receive the veterinary services from them. But anyway, when farmers have anything abnormal, they can freely call the veterinarians. Then if the symptom, if the abnormality of the animal indicate the possibility of major animal diseases such as avian influenza or FMD or classical swine fever, then veterinarian or even farmer can call Livestock Hygiene Service Center, which is located in each prefecture. And as you watched in the video, there are 47 prefectures in Japan. So Japan is divided into 47 parts, and we don't have districts, but instead we have prefecture. So we have 47 prefectures, and in those prefectures, we have 167 livestock hygiene service centers. So it means one prefecture has more than 3 livestock hygiene service centers, or even more. Then the public veterinarians will visit the farm if there is a suspicious case of major animal infectious diseases. Then they will take the samples and take back to the laboratory of them. Then they will do diagnosis. Then if the test was positive, then they need to immediately report to the national ministry through the prefecture. And also we have a national laboratory, which is called NIH, National Institute of Animal Health. Actually, in this training program, we don't have plan to take you to the national laboratory, but you will visit Livestock Hygiene Service Center in Obihiro in the very beginning part of this training program. So then you will see what they are doing, and And also you will see that their old facility of Livestock Hygiene Service Center. Actually, the facility is not so new. It's to be honest, it's really old, but it's very functional. So you can see the important thing is not the facility, but the function. Then I hope you understood this 3-layer structure for animal health services in Japan. And I see Augustine-san raise your hand. Do you have any question?
Yeah, thank you, Samson.
Yeah, welcome.
I have a question.
Yeah.
Are farmers
Mhm.
required to report any infections disease
Mhm.
or only those that are under control program?
Uh-huh. So your question is about the necessity of notification from the farmer.
Yeah.
Oh, okay, I see.
If only and this is infection disease under control program or
I see.
any infection.
All right, a very good question. Thank you, Augustine-san. So there are two types of diseases. One is notifiable diseases. We need to report all of any suspicious case of this. Then another one is just ordinary animal infectious diseases. Then in both cases, farmers first call their own their veterinarians, nearby veterinarians. It's a kind of private veterinarians. Then private veterinarian come to see the animal. Then if the veterinarian clinically diagnosed this is maybe FMD or avian influenza or classical swine fever, then they report that immediately to the prefectural livestock hygiene service center. But if the disease doesn't seem to be such a major animal disease, then veterinarian can start, treatment, like giving advice to the farmer and giving medicine or doing operation immediately at that time. Then, if farmers have any suspicious case of major animal diseases, he or she need to report that livestock hygiene service center by himself or by herself without calling to the private veterinarians. Eventually, the farmer need to call the private veterinarians, but before that, they need to call livestock hygiene service center if that animal is obviously suffering from major animal diseases. And this is the relevant law changed after the outbreak of FMD in 2010. So after that amendment of the law, farmers has a responsibility to call the livestock hygiene service center for report immediately. Otherwise, there is a severe penalty to the farmers. Then, if there are some workers in the farms, even the workers or laborers should call livestock hygiene service center immediately when they find any such major animal disease case without calling their boss or without calling their farm owner. So this is also clearly described in the law, in the new law. So, yeah, is that clear?
Yeah.
Okay, thank you so much.
Thank you.
All right.
Samson.
Thank you. So you will visit this livestock hygiene service center, and also in the next online session, you will have an online session of someone from this animal health division of Ministry of Agriculture of Japan. All right. Mr. Hamza-san. Okay. Do you have any questions?
Yes, thank
Yeah.
you.
Thank you too.
I want to ask that this is the Livestock Hygiene Service Center,
Mm-hmm.
whether it is any mechanism or they are regular visiting, that after how many time they are visiting the farms, or the staff members of the Hygiene Service Center
Mm-hmm.
visiting the farms to check the hygienes and to check the disease status, something like that.
Oh,
Is
very,
there
very
any
good question.
mechanism?
Yes, yes, yes. We do have such mechanism. So when you
Thank
visit
you.
Obihiro, you will visit Livestock Hygiene Service Center there. Then, but the mechanism differs from prefecture to prefecture. So, in the case of Obihiro, the public veterinarians or veterinary officers from Livestock Hygiene Service Center don't usually regularly visit farms. Instead,
Okay.
they ask private veterinarians to do that on behalf of Livestock Hygiene Service Center, because in Obihiro, there are big number of farms and they cannot cover all of them. So
Okay.
there is a special memo of understanding or contract between Livestock Hygiene Service
Yes.
Center and private veterinary clinic, and they Livestock Hygiene Service Center ask them to visit regularly to farms. But in other prefectures, like Miyazaki Prefecture, where we had FMD outbreak in 2010, they have a mechanism to visit farms regularly, and this is designated in the law. So all livestock farms should be visited at least once a year by public veterinarians from Livestock Hygiene Service Center, and they have a special check sheet, and they check all the all the control measures are they check their compliance to the guideline for animal hygiene guideline, and also if there is something which is not aligned with the animal hygiene guidance, the Livestock Hygiene Service Center ask the farmer to change the situation immediately. Then they will visit the farm again to see if the improvement was made. And also, at that time, they need to discuss with the farmer where to bury the animals once the major animal disease happens. So, for example, for FMD outbreak, all farmers need to designate the specific place to bury their animals once they are euthanized during the outbreak. So they are ready to combat the disease even before the outbreak. So they make decision. They need to make decision where to bury the animals before the happening of the outbreak. So that is another important thing Livestock Hygiene Service Center is doing. Yeah, thank you for your question. Is everything clear?
Thank you, Sensei.
Thank you. So,
Yeah.
Slimon-san from
Thank you,
Tajikistan.
Sensei.
Yeah. Do you have question? Slimon-san.
Hello, Kirino-san.
Hi.
Can you hear me?
Sure.
Hello. First of all, I would like to invite you to Tajikistan, to visit Tajikistan.
Yeah.
And I hope the day comes. And I also hope that we can find some kind of points to cooperate, like Tajikistan finds some points to cooperate in order to control or control of any kind of infectious animal diseases, because we don't have any projects in this field with JICA. And I have two questions. So in the video, avian influenza and foot and mouth disease were mentioned along with significant damage they caused in Japan. And my question is, how do veterinary authority coordinate with local farmers to maintain a rapid response during disease outbreaks? So I already kind of got answer to these questions, but could you please clarify, do like local veterinary authority get information by phone call, or there are some kind of platforms that like they receive information from local farmers or veterinarians? And the second question is, I would like to know whether self-treatment by farmers is practiced in Japan or not.
Understand. All right. Thank you for your question. I have also, yeah. And when we meet physically, I would like to listen from you about the situation of FMD SAT1. And so I think you are very busy to combat that, the invasion of SAT1 serotype SAT1 these days. I hope we can talk about that when we meet physically. But by the way, for the first question, the early response to the major animal diseases. So this is quite important. And as I said, the farmer or veterinarian should report livestock hygiene service center immediately when they find any suspected cases. Then the livestock hygiene service center will report it to the ministry. Then the ministry have immediately give instruction to the governor of the prefecture. Then there is a ready for system for early response in each prefecture. So each prefecture governor has their own system to initiate the early response. Then in the case of FMD in 2010 in Miyazaki prefecture, they immediately mobilize all livestock hygiene service center veterinarians, even from neighboring prefectures. And also the number of veterinarians and laborers for euthanizing animals is not enough. Then the number of infected farms were increasing every day. So they started mobilizing association of truck drivers to bring the materials and equipment for burying animals. And also they also cooperate with association for actually we don't have it's a little bit difficult to explain, but we have self-defense force instead of military. So we don't have a military force, but we have self-defense force as a national. Then the people in self-defense force were also mobilized to do burying animals and carrying the euthanized animals. So that was the biggest outbreak ever in Japan, but the mobilization of human resources were done very quickly across the sectors, not only veterinary or agricultural sector, but other sectors gather all together to minimize the spread of the animals. So there is a specific early response system prepared by each prefecture. So the responsible person for the early response is not the head of the veterinary sector, but the governor of the prefecture. This enable the intersectoral or multi-sectoral cooperation, because governor has responsible for all sectors. And also there is a special agreement with police police department So when they do euthanization and or restriction of the movement of animals, we got the cooperation of police officers to stop the road, or to enable some truck drivers, special truck drivers, can reach the farm immediately to bring the materials for disinfection or something like that. And also, you will see in Livestock Hygiene Service Center the storage of the equipment and materials for early response. So all areas have their own storage for such disinfectant or personal protective equipment or such things in advance. So that is the mechanism of emergency response or early response to the major animal diseases. And the second question is about self-medication by farmers. Yes, it is allowed for farmers to give some veterinary drugs to their own animals if it is their own animals. Farmers cannot give medicines to the animals in other farms, but if it is their own animals, they can give it by themselves with the prescription of the veterinarians. So without prescription, they cannot even purchase veterinary drug. So on the street, there is no veterinary dispensary or veterinary drug shop. They cannot buy any veterinary drug by themselves. So when they get prescription from veterinarians, then they have the phone number of supplier of veterinary drugs. Then they can call them and after showing the prescription, then supplier will bring the medicine, something like that. And especially for antibiotics, this system is working very well. So I think you will visit at least one of the dairy farms in Obihiro. Then I think you will ask them to show you the prescription of the veterinarian. Then you will see it physically.
Okay. Thank you for clarification. Thank you.
Thank you for your question. That was very important. Yeah, thank you so much. So I think it's time to close this session. Yeah. So I think some of you still have questions, and I think your question will be solved in the next online session. And even when you visit Obihiro physically, we will talk more in detail. All right. So let me stop screen sharing. All right. Okay. I hope all of you are still awake, even in the midnight or very early morning. Yeah, I'm so sorry for that because of the time gap. Yeah. So I will send you the link of the video I showed you. Then if due to the internet connection, if you couldn't watch it very well, you will watch the video by yourself later. Okay, thank you so much. Dr. Asakura and Ms. Hashimoto, are there any announcement to them before closing?
Okay, so thank you for Kirino-san and the participants for your active discussion and participation to the session. And it's nothing new from me, but I just remind you to proceed your online modules for APCOV for veterinary epidemiology, field veterinary epidemiology, and the preparation for inception report. And next week, in the same day, same time, we will have a lecture about livestock system, disease control system in Japan from Ministry of Agriculture, as Kirino-san explained. Okay, that's from my side.
Thank you, Sakura 先生。Thank you for joining us today. So later I will share today's recorded video. So if you cannot hear clearly today, please check the video, recorded video. Thank you. Thank you so much. So see you next lecture on July 1st. Thank you.
Thank you.
Thank you.
Thank you.
Bye.
See you.
You.
Bye
See
bye.
you.
Thank
Thank
you.
you. See you.
ありがとうございます。
See you.
ありがとうございます
あ。りがとう。